In today's vlog, we're going to talk about one of the most important things that helps you decide when you can afford to retire, healthcare costs. We'll talk about what we expected them to be and what they actually are.
Are we at the end or are we at the start? 129 beats per minute from my heart. Anywhere with you is where I long to roam. Night or day, I'm taking you all the way. 'Cause my heart screams, let me carry you home.
It's Theme Park Bazaar and
Mrs. Bazaar.
Mrs. Bazaar with a t-shirt on. Welcome to today's vlog. A little more update on the retirement. I am fully armed here with my coffee to talk to you in the next few minutes.
And so am I.
Yeah, I guess, you know, you're all talking about the vodka in the last one. Well, it's...
I've got the bigger bottle this time.
And yes, that was real vodka.
And this is real
yes,
rum.
that
Look
is
at
real.
it. You've been waffling so
It took me that
long.
long to get the camera
The ice
set
is
up.
melting.
The ice is, she gets upset.
And then it waters down the rum.
Yeah, she does. Actually, Maxine only drinks it
Neat.
neat raw, don't you? Yeah, is this the palm stuff you got? Oh,
Yeah.
look at that, yeah. So we're going to get through this next short time with the vlog. Hopefully, grab a drink, sit down. Oh, and when we get later on at the end, near the... Is it good, that?
I haven't tried it yet. I'm just anticipating it.
And when we get near the end, remind me, you in the red shirt over there, no, red shirts never make it to the end, do they? You in the blue shirt, remind me, I'll give you an update on what we did with the money that we got from selling the Tesla, which was in the last vlog. So today we're going to talk about healthcare costs and a couple of things. Well, obviously, I'll just give you a bit of a catch up if you haven't caught up today. I retired, 3 months ago?
It is 3 months ago.
At the age 58, we're both 58.
Hey!
And
I am not 58. I am the baby.
you're nearly 58.
I am not nowhere near 58.
How old are you then?
Never you mind how old I am.
They say a gentleman never asks a lady
This is
her
not a
age.
gentleman.
Yeah. So how old are you then? Let's say.
Nope.
No, Max isn't 58. I'm 58. And we were we've been planning retirement for maybe 5 years. And one of the big things deciding could we pull the trigger on that was healthcare costs. Biggest thing, isn't it, over here?
It's a huge thing over here.
So we'll just explain a little bit because a lot of our viewers are Brits who are looking at us since we relocated here. Or just for you who don't know, we relocated here. Is it 19 years this...
November.
November, yeah.
Yeah, we came over with the kids and the dog.
Yeah, this November will be 19 years since we came here. And we'll catch up a little bit, just a little bit for the Brits and for our American viewers, tell you a little bit about the Brit system. So basically, when we're in England, I worked there for 24 years. Max worked there for 24 years before we moved here. There is something in the UK called the National Health Service. So the National Health Service was created in after the Second World War. And it's really, it's basically, and I put up, you can see this, I put it up on the screen. Virtually the entire population is covered and health services are free except for minor charges. And that really jumps into three different groups. General practitioners who are GPs. Mm-hmm. Or family physicians give the primary medical health care, and then you've got hospitals, and then you've got dentists, and they're kind of paid on a different area. People say it's free, but it's not really free. It's paid for out of taxes.
So everybody pays.
Everybody pays. So when we were working, we were paying national insurance for 24 years in there. And even then, back in the 90s, before we left into the 2000s, the healthcare... It was struggling, wasn't it, as far as funding? So I think my company and many others were giving private healthcare coverage, even then, for hospitals and dental work. I think it was called Bupa back then. You have to tell me what it's called now. It's called Bupa. You paid a little bit into your out of your salary, but it covered that, and that got you a priority sort of service, your own private hospital room, things like that. So even then it was kind of half privatised, because you couldn't even get a dentist back then, could you?
No, I don't think you
struggle
could.
to get a dentist,
struggle
to get one that was public dentist as opposed to a private practice. So that was the experience. And we do know we go back and see our family a few times a year, or often as we can, our parents. And we do know if you go over there, we don't have to get insurance, because we can still get NHS coverage to go in there. And that includes all operations, whether it's a heart transplant to just going and getting some medications, though you do pay for your prescriptions. Prescriptions are a different thing as well. So that is that's the UK system. The US system is completely different. The US system is totally based on private healthcare until you get to the age of 65. And I'll show you some facts, some stats here. So basically here in the US, you have health insurance that covers personal coverage for individuals for those costs. It really is, you know, what happens is there's three different groups really for coverage. You've got employment-based. Most companies offer a plan. Large companies offer a plan where you can get insurance if you're full-time, not always part-time. You have a direct purchase where you can go through something called the marketplace, health.gov, we'll talk about that later, or an insurance company. And then there's TRICARE, which is really for a medical program for people of uniformed services. And then that's for your whole life until you get to 65. And then there's a thing called Medicare and Medicaid chip in, and I'll talk a little bit about that later on. But it's a very different system over here, and it's something that you have to get used to. If you go back to the vlog that we did when we did the road trip, even though you have health coverage, you still pay out of pocket, don't you?
Out of pocket when you go and see a doctor.
Yeah. So basically, the plans that you have over here, if you're in a company plan like I was, you have different tiers. Like ones, if you're reasonably healthy, you will pay a lower premium every month, and you'll pay a higher, what they call deductible, when you go and see the doctor. Mm-hmm. So if you're expecting to be healthy, you'll pay less out every month. But if you do go and see them, you'll pay more. And if you're on prescriptions, you pay more. And if you need medical care already, then you can pay a higher premium monthly, and then your out-of-pocket deductible becomes less.
Yes.
For us, when we were over here, I think when we had the family, and it covers the family as well. I think our company one covers your kids up to like 27, 20, was it 26?
26.
When they come out of university, college, for there. So that was the idea of that plan. But I think we were paying on the cheaper end, or shall we say the lower end, when I was working of the plan. It was probably some in the region of $400 or $500, maybe $1,000, $300 or $400 a pay packet, and you get paid every 2 weeks here for that. And then this deductible could go up to, because as I say, we paid lower every month, then the deductible was higher, and I think it could go up to like $11,000 maximum in a year, and then everything would be covered. So up to the first $11,000, we would pay it, even though you get discounts on things like prescriptions.
And even though you'd paid,
and even though you're paying in every month. But if you had you went into hospital, and going into hospital could cost you a lot of money. Thousands of dollars. I went to ER once just to have a checkup thing. It was $1,000 because you get billed from. We had a bill from the person who checked me in. Yep. The person who did the triage checked me out. I had the doctor's bill. I had the bill from the people who did the blood tests. I had the people who pushed me down to the X-ray department. I had the bill from the X-ray department. I ended up with like 10 bills from all these different people. It was a big eye-opener, wasn't it? Yeah, and it was like $1,000. And when we had that, we alluded to when we had the accident and I hurt my ankle. Even today, in the plan I'll talk about later on, I think it cost me to see the doctor. Was it like $150 I had to pay out of pocket, even though the actual cost to see the doctor in the emergency room was $300. Yeah. So insurance paid 50% of it, and I ended up paying 50%. And when Maxine had her MRI on your knee back there, her knee's still not right, but when you had the MRI, how much did we pay for that?
We paid $500.
Yeah.
They covered 90%, so it should have been $5,000 for an MRI. For an
MRI. So give you some idea of the costs here. So what we did, something I recommend if you are working, something we did over here was open a HSA, or a health savings account. We opened it with HSA Bank. And what HSA is basically is a savings account that you take money out of your pay packet, and in a lot of cases the company will contribute to it, match it. And it goes into a fund that can only be used for paying for dental, medical, and eyes. Yeah, anything for your eyes as well, your eye insurance.
And your prescriptions.
And your prescriptions, yeah. So, but it goes into this account. It's not tax-free, but it can be only used for that, and you get a credit card to go and take it out. And we started putting into that when we came here, when we had those eye-openers, because obviously $11,000 was a lot of money. We didn't even have $11,000 when we came here. So what we had to do by opening this account and slowly putting in money, we've had that now 19 years, and because it's our account, it can transfer with you when you change jobs. It's not owned by a company. So even now I'm retired, I still have a HSA with HSA Bank. I still have that account, and we still use that today to draw on. Obviously, we're not putting money in it anymore. No. I guess we could. but we're not putting any money in anymore. But we did get it above that $10,000 level, $11,000 level after about 10 years by just putting in every month. And what that meant is that I knew it was like a safety net.
Yeah,
If we ever
it
had to
is
go,
basically a
if something
safety
was major happened,
Yeah.
we were covered.
Yeah.
We were covered by it. So that was one side of things. So you may say, well, how much of the US is actually covered by these private plans? Well, I think I put a picture of a study in here from a couple of years ago. It's about 92% of the US people have private health care and the rest don't. And so you see it is pretty much it's pretty much a mainstream thing that everybody has, but it has put a lot of people off coming here. We have friends who would love to live here in the UK, but the medical costs of moving here would just be too much. You know, that paying out that kind of money every month until you're 65 is a big deal. So, you know, you have to factor that in if you're going to relocate over here. It's part of the life over here. It's part of the things
You can't get around it.
You can't get around it. And costs didn't really vary depending where you were. But there's a couple of things you can do. When you're looking at early retirement, we'll go through some of the numbers that we were quoted by our financial advisor, and then we'll talk about some of the benefits that work gave us or offered us when we retired 3 months ago, what we ended up deciding, and then we'll look at the marketplace and some of the things that we may do in the future. But if you are thinking of retiring, and say we planned 5 years ahead, here's some things you can do ahead of time to make it prepare, shall we say.
Prepare.
Number one is pump up your HSA.
Yep.
While you're working. If you can afford it, max out your contributions to that so that you have, you know, we have a nest egg of money now that we can draw on till we get to 65 to help us with that. Second thing is, what did we do for the last 2 years?
We got everything checked out.
Yep.
We had everything done, the medical, all the tests that you need doing, blood work.
Yeah, I got all my
eyes.
It may not look like it, but I had all my dental work done.
All my dental work done.
I was trying to get it done in 2000, and then COVID came along, so we put it off to 2022. But you know, fillings like $300. I've had about 4 root canals, and they were $1,000 each with insurance. So we really went to town. We both got new glasses.
New glasses.
We knew we were going to retire, so we wanted to get any medical concerns out of the way before then.
Yeah, because we didn't know after what medical coverage we'd have, did we?
No.
It would be because when you were working, it was a really good thing, wasn't it? And a good plan.
You have a plan.
But you never know.
You have a program they call in-network and out-of-network.
Yeah.
And so basically, if you use doctors in-network, it's covered by the plan.
Yeah.
If it's out-of-network, then
you pay more.
And, you know, finding a good doctor is hard. So we found some good doctors and dentists and opticians. So we wanted to get all that done. So that's another tip, max out what you're going to do before you retire.
Yeah, because most of they're called preventative care.
Yeah.
Aren't they? Like you once a year you get like a full workout. They do everything and check all your bloods and everything and make sure everything's okay. And that's covered by your insurance.
Yeah, that's free. Yeah.
So you want to max that out.
And if you find any problems, get them fixed.
Yeah.
That's why we had your knee. We were working on your knee.
Yes.
It didn't work out because it's still not good. But that was part of the reason for that. Was your knee.
Yeah, and don't forget, you don't just go and see one doctor for your knee or whatever. You've got to go and see a specialist.
Remember, for your right knee, there's probably a specialist for your left knee as well.
There's probably, yes, there is, but
yeah.
It's another specialist doctor, and they cost more money if you see a specialist.
You get referred. Yeah, like in the UK, a GP does everything. Over here, you don't have that.
No.
You have I forget the term for a practitioner. You do have a general practitioner, but if you need any work doing on an elbow, a knee, a leg, or whatever, they refer you to a specialist in that area.
Yeah, and it's the same with your dentist.
Yeah, that's true. Yeah, the people who did my root canals were not the same with you.
Yeah, I went to a different root canal to you.
Yeah, the dentists don't do that kind of work over here. They kind of just do the general work, and then which again, more money. More money coming out of it. And here's another top tip that I wasn't aware of is I was going to resign. When was I going to resign? Was it March? Was it April 30th?
Last year.
Was it April this year?
Oh, this year.
I know it's been a long year, hasn't it?
It's been a heck of a long year.
Yeah, April 30th.
I thought you meant the first time.
Oh, no. That's a different story for another day. But that April 30th, I think. And then one of my colleagues said, check when your healthcare expires.
Yeah.
And if I'd retired on April the 30th, my healthcare would have expired on April the 30th. By retiring on, was it May 1st?
May 1st.
By retiring on May 1st, I had the whole month of May before my medical coverage expired, which meant I had a month to look around and look at different options at what I was going to do. So there's a top tip. Never retire at the last day of the month. Always retire the first or second day of a month, and it'll give you the rest of that month as a buffer with your current insurance plan.
Yeah.
Just in case, which was a lot less stressful for us.
Yeah.
To do it that way. So what happened was about a month before I told you she needs another drink. About a month before I retired, I got an email. I'll put it up here on the screen. What I got from my company. There's 3 options, and I'll talk about them. One is called Cobra, where you have to call the telephone number for them to help you do that. Also, there was another link they gave me of stayingcovered.com, which gave me additional health coverage in our area here in Florida. And the final one was healthcare.gov that I mentioned earlier on, .gov that I mentioned earlier on, which is basically the marketplace. And the thing is about Cobra is you can't find out how much Cobra will cost you until after you retire. Once you've retired, they will send you the quote. But a little bit more about what Cobra is, in case that's new to you. It's Cobra stands for, and I as you can see, I nicked this from the screen. Consolidated Omnibus Budget Relocation Act. Oh. In simple term, it allows you to keep your current healthcare plan for up to a maximum of 18 months. So you keep the same doctor, you keep the same dentist, you keep everything the same, up for 18 months to give you a transition period to find something else. But you can't find out what Cobra is until such a time as you retire. So that's why, and they promise to get you a number within 3 weeks, which is why having that month's buffer was really good. Yeah. Because I could sit there, look at these alternatives, price everything up. But we'll take one step back. I did mention in the other blog about getting a financial advisor and a financial planner. And before, when we were looking at when we could afford to retire, we went with them and we took their guidance. They were recommending up to age 65, we budget $20,000 a year. So that's what they said, and that's what was in our plan. And I started looking around the marketplace, and I was struggling to find programs that would do your health and your teeth and your eyes for 20. They were right in the limit of that $20,000 when I looked at the healthcare.gov. And so I recommended 24. So I told them to put $24,000 a year into the plan. They use all these models like Monte Carlo and fancy models where they look at your savings, you look at your outgo. You saw that list I did last time of all the expenses. They say when you're good to go. And we kind of agreed that the end of this year, end of 2024, for January 1st, 2025, we could make it work based on those numbers of the 25. So we were looking at $2,000 a month, basically, is what we expected to pay out up to the age of 65 with Medicare. But as we talk about with Medicare, you still doesn't cover everything. You've still got other things that you have to pay for. So after 25, it transitions to $14,000 a year we should expect to pay to cover things like, I'll talk about the Medicare stuff later on. So you still have to have money after you're 65, but we were looking at $24,000 if you look at it a monthly, we were looking at plans that were under $2,000 a month to make it work for us. So I checked out healthcare.gov, which was set up about 5 years ago. And there's all different kind of providers. You put in the area you live, and then they offer different services. Some do dental, some do vision, some do all. And there's different tiers like gold, bronze, silver, and then they all do different coverage levels. Like your deductible and everything. It's not easy, is it?
It's complicated.
Yeah, it's complicated.
Very, very complicated.
So we went through all those. And this is as I was coming in, before I retired, I was looking at this. That's why I came up with the $2,000 a month. And here's some examples of the things that I saw. So here you can see on the main screen from healthcare.gov, you can look at short-term dental and vision, accident, critical illness. And then you look at your area, and then you just scroll down all the different plans, and they'll tell you, these are some of the cheaper ones at the bottom end of the scale, just for the health. But I would say the ones that we were looking at, which covered the dental and vision and health, were up around that $1,800.
Yeah.
So you start about $400 a month, and you can go up to $5,000 a month, depending on the coverage you want from there. And you have to put your total income and your total taxes and where you live and all that kind of stuff. And it gives you some insight into those. But the thing about the health insurance marketplace, I guess is the real term we should use for it, is there's an enrolment every year from November 1st to January 15th. And that's when your coverage, you can enroll, and your coverage starts on January the 1st. So I knew that even if I wanted to go with this, it would, we'd have to get through, earlier in the year until Christmas to be able to do that before the plan kicked in. Did we have enough money in our bank? So think about it. We talked about $12,000 a year. So $24,000 a year. We really needed, if we're going to retire in June, well, June would be the last month, May, June time. We needed 6 months worth of money available to be able to finish early. So we needed $12,000 cash available to cover
just in case
the $2,000 a month. And the reason that we did pull the plug earlier than December is, if you're watching our house renovation vlogs, we picked a different contractor.
Yep.
And what happened when we picked a different contractor?
We saved quite a bit of money.
Yeah, basically everything came in half price. So we had put a budget, we put money together to pay for the last ones.
Yeah, we already had the money together.
And when it finished and we had that kind of money left over, and then this money came in and we're like, what do we do?
What do we
had
do?
long conversations about it, didn't we?
Long conversations.
Do we do it now? Do we wait till the end of the year? But we decided to retire early and use that money to cover. We had $12,000. We thought, okay, we know we're good till Christmas.
Yeah.
And then the plan for getting the money out of the 401ks comes in, and we should be covered from Christmas. Yeah?
Yep.
So that was the plan. So we looked at those prices, and like I say, it was $2,000 a month. But we didn't know how much Cobra would be, did we?
No,
At that
not
point.
at that point.
But we knew we'd probably need Cobra until Christmas. I think there's exceptions. You can get the other one a bit earlier.
Right.
If you something, a dramatic thing happens at work, you can have an exception to do that. So we applied for the Cobra, and then they came back with the numbers. Remember, Cobra is keep your existing doctor, dentist, and all that kind of thing. And the numbers for Cobra per month came in at, what was it again?
Was it $1,600?
$1,550, I think it was.
Right, yeah.
So we had enough, we were budgeting for $2,000, and Cobra for us came in at $1,550.
So it was quite
a month. So it was a lot cheaper.
A lot cheaper.
Yeah.
We were surprised.
Than the market. Yeah, we were very surprised in the
surprised.
marketplace, which made us happy.
Yeah, very
happy.
happy.
Like, we only needed, $10,000 instead of, more money.
Yeah.
So we had a bit surplus there, which was good to have. But yeah, when we looked at the program, it stayed with our current doctors. We got to keep our HSA, of course. And here is a screenshot of our plan that we currently have. Not how much we pay out a month, but you'll see our deductible in here. If you look out at the side now, the deductible, the out-of-pocket maximum we would ever have to spend for me is $6,850. And between us, the family, so you and me together, would be $8,000 between us. So it's come down from 11 to 8,000. That's the maximum out of pocket. And then 100% of services are covered by the plan. But the main thing was keeping our same dentist and doctor and everything. And we decided that can run for 18 months. So that can run until the end of November next year. So we're going to keep it.
Oh yeah.
It makes sense, because when you look at the marketplace, they were, or as they were when we were looking, they were a lot more expensive than that.
About $400 more a month.
Yeah. I mean, and so here's an example of one of the ones. This was just one of the cheaper ones, as you say, the $500 ones, $500 a month. But even then, you're paying like nearly $10,000 out of pocket deductible. And you can see on here what's covered as well. I mean, your primary care, you have to pay a deductible on it, but there's no charge for some of them. So it really depends how you mix it up. And you can see the plans on the right. There's bronze, silver, gold, platinum is like the most expensive one. But we couldn't find anything around for you and me for the coverage. And that we're talking about not the gold. I think I was looking at silver. I wasn't at the gold. I wasn't at the platinum level. And they were coming out about that $2,000 a month. So that's the current status. So if you are thinking of retiring early, I would recommend taking our financial advisor's advice and think of $2,000 a month. And again, everything I'm saying is for us here. So it may differ for you, your age, it may differ for where you live in the US. I'm just giving you our case. But for us, it was that $2,000 a month was was what we needed. So look at your savings for that. And do you have a projected enough to get you through to when Medicare would kick in at 65? But don't forget, Medicare doesn't cover everything, and you still need money at 65 coming out of your we got 401ks. That's going to be the main part of our savings that will come out of there from the 401ks that we've been paying in for the last many years we've been here in the US. But if we talk about Medicare, let's talk about that for a second for our Brits who are watching here, UK people. So Medicare is a health insurance program for age 65 and older. Or you can actually, you're eligible earlier if you're disabled.
Yeah.
You can get it early if you're disabled.
Oh, yeah, I forgot.
And you can sign up for that. But basically, it's 3 different areas. You get you're going to get your Social Security benefits before 65 or at 65, or you can do your own plan as well. And basically, Medicare.gov is the site that takes you through this. And there's basically 3 parts to Medicare. There's Part A, which is hospital insurance, nursing, home and health care. There's Part B, which is medical insurance. So that's services from doctors, outpatient care, home health care, equipment if you need it at home. And then there's Part D, which is drug coverage as well. So there's 3 different parts of Medicare. And just to give you an example of here, if you look at Part A, so basically for Part A premium is typically $0 for most people. So basically you have to be working in the US at least 10 years to get the free premium over here. And then there is a deductible before it starts to pay of $1,632. And then there's co-payments if you're going to be staying in the hospital as for longer periods of time. So it isn't free. As I say, you have to have money for that. For Part B, depending on what you do, it's $180 a month if you need coverage for prescriptions. If you're going to get prescriptions every month, then there is a cost for that as well. And I'll go into more detail here on Part B. You have to sign up for Part B. Part B doesn't come automatically, I believe, but you tell me if I'm wrong on this. But you have to sign up for Part B, and there is a deductible for that as well. And then there is Part D, which is your prescriptions. And again, there is, shall we say, time you sign up for that. I'm not sure if there's a deductible for that on the premiums for Part D. We haven't really got into it in too much detail yet because it's so far away. But one of our friends has recommended, and what I did buy was this, which is Medicare for Dummies, which I will read as we're getting closer to that. But what we plan to do now is keep our Cobra until November and then go to the marketplace and look for a program on the marketplace to see us through, because then hopefully I will be just turning 60 then, won't I?
Yes.
So we'll have 5 years, which I'm still expecting to keep on that around that $2,000 a year. $2,000 a month, I wish it was $2,000 a year. $24,000 a year budget for that. So hopefully that's giving you some insight into the complexities, the costs, the realities of retiring early. That's why a lot of people work till 65 because just the healthcare costs.
It's expensive.
It's very expensive. A lot of people retire outside of the US to other countries because of the healthcare costs. But it is what it is over here. It is what it is. So I hope that was useful. And then finally, thank you very much, Blue Shirt person, for reminding me. So we sold the Tesla 2 weeks ago, is it now? It's only 2 weeks ago, isn't it?
It is only 2 weeks ago.
And what I did this week is I took the money that we had from the Tesla, and over here in the US, they're looking I'm no forecaster, don't rely on me for anything, but they are talking that the Feds will cut the interest rates. And we're keeping Maxine's Ioniq 5 now. People said to me, actually, why did you sell the Tesla over the Ioniq 5? And one of the main reasons was the Tesla was depreciating like $500 a month because of the cost cutting of Teslas here in the US and the marketplace being flooded with Hertz and all the rental companies. The depreciation was terrible, a lot more than yours. And we also have a year's free charging still left on yours. Yeah. So it's really a no-brainer to get rid of that car So we took the money. We may change yours when the free charging finishes and go for a hybrid. We don't know yet.
We don't know yet.
But I thought, let's make this money work for us. So I opened a certificate of deposit or a CD with the bank 2 days ago, a 7-month one, and I think it's a 5% yield. So that will be earning me, you know, $300. I don't know the math in my head, but $300 or $400 a month interest over losing money every month. So basically, it's like $800 we're making by selling that car. Oh, insurance as well. Insurance was another $100 a month that we're not paying out on the car as well. So rather than, you know, that's what we decided to do, was put the money in the bank, have it working for us while we decide, and earning a bit of money, rather than it just sat there depreciating. But there we go. I just wanted to wrap up the last vlog. I hope this was useful for you. I know it may be boring for you, but it's the real life world of retiring here in Orlando, Florida. If you got any questions, put them below. I'm sure you have, and you can correct me on all the things I've said wrong about Medicare.
Probably.
I don't know yet. I'm not there yet. I just kind of read a little bit on it. I've got my dummies book to read later on. But please feel free to comment. And if you like what we do, please like and subscribe. Put all your comments below. We'll try and respond to them. And we will finish our coffee and rum. And we'll see you later. Bye.
Bye.